We're going to talk about IBS, irritable bowel syndrome. I've been having a really hard time and being tongue-tied this morning, so worse than what I normally am. So I just want to just kind of preface that because I've done this 4 times already and have really messed it up. So just bear with me, and we'll talk about irritable bowel first on this session. And let's go back to our other slide first. Okay. IBS is a condition that's characterized by chronic abdominal pain that's associated with alteration in bowel habits. This increased intestinal motility can lead to spasming, it can lead to pain, and so when we look at the reason for it, then we know that we're going to be given antispasmodics for these children, or even for adults who have IBS. And one of those would be Levsin, or Donatol. So those are the kinds of things we're going to treat with it. The etiology, stress, especially children. You know that children can have recurrent abdominal pain, which isn't unusual, especially in the child that's older than 6. In many cases, the cause is just unknown or unexplained. The symptoms can resemble those characteristics of irritable bowel syndrome. So our exact etiology is not understood, but it's believed to be triggered by those stress, emotional factors, or infection. There's other risk factors such as family members with a similar GI disorder, and history of childhood sexual abuse, which is important, especially if a teenage girl or boy or school age come in and you cannot figure out exactly how come, and you've done your abdominal ultrasounds, you've done your x-rays, make sure that if the condition permits and the symptoms permit, make sure that you may have to do a pelvic or question the teenage girl or boy, alone without the parent in there, and see if there's any type of sexual abuse going on. So that's important to remember. So on diagnosis, we basically are looking at ruling out other disorders such as Crohn's disease, Giardia, lactose intolerance. We can do an abdominal ultrasound, stool for O&P, cultures, abdominal x-rays, and as I mentioned before, we need to do a complete gynecological assessment if age appropriate, and that's often ordered, especially if they think that there is a problem with a sexual abuse. So there's no definitive treatment goals aimed at identifying and reducing triggers, reducing the bowel spasms, which we talked a little bit about before. Diet is healthy, well-balanced, moderate fiber, lower fat. Encourage the child to eat slow, no carbonated beverages, no juices. And our medicines, we'll use the antispasmodics such as Levsin or Donatol, some antidepressants. We have to just make sure that the child can take those, depends on what age. Some SSRIs or tricyclic antidepressants are sometimes used. So usually the prognosis is pretty good with these children, as long as we know exactly what is causing the underlying problem with whether it's a psychological problem, whether it's maybe school, emotional events, any kind of stress in the family. And as we all know, there's a lot of stress in our families. So those are all things that we would need to assess when we have children with IBS. Okay, that's it for that. And we'll conclude and go on to the next